Cerliponase for infantile neurodegenerative disease. Neurodegenerative diseases are diseases that progressively kill or damage brain cells, leading to a loss of brain function. Infantile neurodegenerative diseases affect infants and manifest in children between 2 and 4 years of age. Infantile neurodegenerative diseases are not easily recognized, as their symptoms are quite similar to other pediatric problems. Such diseases affect both the grey and white matter of the brain. The problems that arise when the grey matter is impacted include mental retardation, seizures, hearing and vision impairment, whereas the problems that arise when the white matter is impacted include the possible loss of motor skills, ataxia, which is the loss of full control of bodily movements, or spasticity, which is a condition in which certain muscles contract continuously. The main causes of infantile neurodegenerative diseases, from most common to least common, are genetic and biochemical defects, chronic viral infections, toxic substances, and unknown causes. An example of an infantile neurodegenerative disease is ceroid lipofuscinosis type 2 disease, or CLN2 for short. CLN2 is a rare, inherited infantile neurodegenerative disease that primarily affects the nervous system. It has an estimated incidence range of 0.22 to 9.0 every 100 live births. Symptoms generally begin to show between the ages of 2 and 4. CLN2 is caused by a reduction in the activity of the enzymes tripeptidol peptidase, or TPP1 for short. The reduced activity of TPP1 enzymes is due to mutations in the TPP1 or CLN2 gene. TPP1 enzymes are found in the lysosomes of neurons and function to break down peptides into amino acids. However, due to their reduced activity, the peptides do not get broken down into amino acids, but begin to accumulate in the neurons, which causes the cells to die or damages them. The symptoms of CLN2 include seizures, ataxia, motor skills deterioration, loss of language, and blindness. CLN2 can be treated using cerliponase alpha or Brineura. Cerliponase is the one and only drug that's been approved by the FDA to treat CLN2. It was approved in April 2017 and was developed by BioMarin Pharmaceutical Incorporation. Cerliponase alpha is a recombinant form of the human TPP1 enzyme. It is an enzyme replacement treated that treats CLN2 by replacing the deficient TPP1 enzymes to restore the normal levels of TPP1 in the body. Cerliponase alpha does not cure CLN2 but slows down the ambulation, which is the ability to walk that occurs in symptomatic patients from late infantile to 3 years of age patients with CLN2. Cerliponase alpha is administered to the patient via intraventricular injection, which allows for significant uptake into the brain. The side effects of the use of cerliponase alpha include fever, vomiting, seizures, reduced heart rate, decreased blood pressure, blood clotting, and hypersensitivity. There was only one clinical trial for cerliponase alpha usage, and it was conducted by Schulz in June 2016. This study focused on the safety, tolerability, and efficacy of cerliponase alpha in children between 3 and 8 years of age. The patients were subjected to progressively larger doses of cerliponase alpha each week for 48 weeks. 87% of the patients did not suffer a decline in either their walking ability or motor score, and 58% of patients reported adverse symptoms such as hypersensitivity reactions, fever, slow heart rate, vomiting, and headache. Moreover, there are no clinical treatment guidelines in place for the usage of cerliponase alpha, but management is based on patients' adverse reactions. Furthermore, the safety and effectiveness is yet to be determined for patients under 3 years of age. CLN2 is truly an awful diagnosis that robs families of life with their children much too young. However, with the approval of CA, which has been heralded as a medical breakthrough, children with CLN2 and their families are given much needed hope.